booster. We expect it on the ground in Colorado by the beginning of the week, and we expect it distributed 2 locations in Colorado by the middle of next week.
All right. They were saying that people could start getting the vaccine out very quickly. That does sound very quickly. So what kind of percentages are we looking at that it's still a very low percentage that's going to get out in the first instance, right? Like 1% or something like that, right?
Right. So, first we have to say, this is to recognize how quickly a safe vaccine was developed and is in production and is starting to be distributed. It's just, it's astounding that this is a feat in human history that so much went into getting up here, right? So that's crazy that we're going to have vaccine next week. The problem is, across the whole state of Colorado, we're going to have less than 50,000 doses. And we know that close to 6 million people live here.
Right. Yeah. There's quite a few. So, but it's a step in the right direction, and it's hope. Hope is alive.
It is hope. There will be some really strict rules as to who's eligible, across the whole state. So just remember, 6 million people, close to 6 million people live in Colorado. Our first shipment will be less than 50,000, right? And so it will go out to very specific healthcare workers who are on the front lines, who need to be able to be healthy to treat people with COVID-19. So that's who's going to be protected first. There'll be then, this process as more vaccine becomes available. It will go to other healthcare workers. It will go to long-term care facilities. It will go to residents of long-term care facilities, because that population is just so vulnerable. We're having a problem here in Durango with one of our long-term care facilities. It's absolutely devastatingly tragic. So that needs to be another priority group. Then after the long-term care facilities, it goes to other first responders because they keep all of us safe. And then it goes to, kind of a broader swath of healthcare workers. So there's a whole plan of how it gets rolled out. This is going to take, weeks into months. There's lots of people that won't be eligible for vaccine until next summer. So I just want to be clear, this is great news, but we all still have to do our part.
Absolutely. And you say long-term facilities. I obviously elderly are pretty high on the top of that list. We do have the issue with the nursing home here, but so some of the more vulnerable individuals in our communities.
Yes. So in the 1A, which is the top tier priority, that's actually going to be individuals who work in what we call long-term care facilities, but other people call them nursing homes, right? It'll be those people, and it'll be people who live there. But then when we move into the next priorities, people who are over 65 or people with chronic disease, they'll be ahead of potentially people like you and me if we're younger and don't have any chronic disease.
Absolutely. That makes a lot of sense to me. I have a 90-year-old grandmother, used to be on the radio show. She'd do advice columns with everybody, but very, very concerned for her right now. So I'm happy that, there is an order to that. I don't mind waiting. I'd be the first in line if they wanted me to, but I don't mind waiting either. So
right. And we want to protect a more vulnerable population. So that's exactly the right way of looking at it. And, you and me will still have to do protection, do our precautions between now and when we're eligible for a vaccine.
Absolutely. And happy to. With that rolling out, that's a really promising thing. Very excited about that. We've got the Colorado vaccine information with that. And we talked about the nursing home issues right now. How we're still not doing great at Mercy, right? The hospital is a little overbooked at this point, isn't it?
Yeah, our hospitals everywhere in Colorado are stretched and stressed treating COVID patients. So we do have to say that through the month of November, Colorado, really increased the attention to the spread and increased restrictions. So most counties in Colorado moved into these red level restrictions, which really limited capacity, limited restaurants to take out or, winterized outdoor dining. So it really targeted some of the specific places where there's spread. And we started to see in the last week or so a result where the hospitalizations have come down just a little bit in the last week. So we were at a high of about 1,800 to 1,900 people hospitalized across the state. That came down. It dropped by maybe 200. But right now, like right today, we're 2 weeks out past Thanksgiving. So we're not sure what's going to happen next, right? And this is the thing that we've all been kind of bracing ourselves for. We did a good job going into Thanksgiving, but we don't know how much infection was spread actually Thanksgiving weekend, and that may start to show back up in hospitalizations real quick.
And is that something that you would anticipate us kind of starting to see those numbers of what happened and how we did maybe when we talk next week? Would we have a better idea of that?
Yeah, I think we'll have, it's always easier to see the patterns across the whole state because the population's bigger, and so we can get a trend going, and we can talk about that next week. But we can, also talk about locally, which is, our hospital is doing the best it can in trying circumstances, right? Because there's not, I think we've talked about this before. If you need to kind of staff up because every bed is full and you've added beds and you're adding in, more acute care, it's not going to be that easy to find the staff for that. And that's what the stress in the whole hospital system everywhere is right now.
Well, from what I'm hearing, there's been some rumors out there that we could very likely go into the level purple, but from what I'm understanding from you, that's not. I mean, it's just up in the air. We don't know at this point. We don't have that information yet.
No, there's so much being done. I mean, there's everybody's paying attention to how do we increase care at the hospital system rather than go into a purple lockdown, right? So as long as we are not overwhelmed, but there's, like you said, there's a huge amount of ifs there, right? The reason our numbers came down is because more restrictions went into place in November, right? If we keep those restrictions up, then we'll be okay. If Thanksgiving and then, holiday parties continue, that conversation, it'll have to happen because all the work that goes into stretching the hospitals may not be enough if we can't get staff.
Absolutely, yeah, definitely need some staff. I hear good news with that. I mean, obviously, it takes a while to become a hospital worker and everything, but it does look like in the news of some of the good news that we talked about today that there is an uptick in people that are looking to become be in the medical field in the future, and they do kind of credit that to the pandemic. So that could be something good.
Yeah, it's interesting. I've heard it labeled the Fauci effect.
Exactly, yeah.
I mean, who wouldn't want to, what a great thing to say, this is what I want to do. I want to help, individuals get better and avoid disease. And then I want to help whole communities and whole countries, figure out how to navigate these tricky things. So I think it's awesome that people are looking at this.
It's a great thing, yeah. All right, so I did want to ask one more question on the vaccine. I know we're way past that at this point, but there was news that came out from Russia that seems weird to me that they are encouraging the people that will be taking their vaccine to not drink alcohol 2 months before and after. Is it a different vaccine? Have you heard anything about that with our vaccine? Anything like that?
I haven't heard anything specifically about that. I would say that we expect that part of what a vaccine is doing is it's stimulating your immune system. So, I mean, it would be a good idea for all of us to think about how to stay healthy. We do expect that some people are going to have some symptoms after receiving the vaccine. These are not symptoms of COVID-19, but they're reactions to the vaccine. So, we've heard reports of redness and swelling. We've heard reports of people feeling, some kind of flu-like symptoms, a little bit of fever, maybe some fatigue. So, with all of that, I mean, 2020 has been a rough year. So let's treat ourselves right. Let's treat our bodies right. But no, I haven't heard anything specific like that.
Well, that's a relief to me. I like having a beer at the end of the day. So, What can we do about the further holidays coming up, Christmas and New Year's and that kind of thing? Obviously, families are going to be spending some time on Christmas, although it'd be nice to keep it as smaller groups. And I know that that's the encouragement there, just like it was for Thanksgiving. But what can we do to encourage people to be safe during that time? Because it's even more of a red flag than Thanksgiving was, wouldn't it be?
You know what I think? I mean, I just kind of made this analogy up the other day, which is it's kind of like this Christmas, we still have to be really, really careful because we're not at the end of this yet. We're not at the finish line, right? Getting the vaccine out and getting everybody safe is months and months. So what we can't do is think, okay, we're almost to the end, so let's just throw caution to the wind. And the analogy I was thinking is, have you ever heard the statistics that like people get into the most car wrecks when they're like in the last mile of a long
I have
trip?
heard that, yeah.
Yeah, and so I hope we don't do that as a whole society, right? Like, yes, there is vaccine coming. Yes, there's good news coming. Yes, it's going to be months and months before we're really able to lift our precautions. So please don't think, okay, I'm hearing this good news. It's that last mile of my road trip, and I don't need to pay attention anymore, right? Because like we still need to pay attention. Christmas is going to be every bit as hard as Thanksgiving and every bit as hard as every other sacrifice we've had to make in 2020. And, I think you and I can talk next time about like, okay, well, then if we know it's going to be hard, let's get creative. So how about we do that?
I like that. Yeah, absolutely. We're all about getting creative over here for sure. Now, we were chatting with Jack, and I know that this is a tough subject for everybody, but they are trying to implement a five-star system that other communities have done before, or I guess have activated and whatnot. Now, in a level red, that can still be dangerous, of course. But I did want to ask kind of on that route. There are a lot of businesses clearly that are starting to get desperate and they're looking to try to find a way in. Now, I know that we both agree in the sense that the issue is not with the health department. The issue is not with the small businesses. The issue is with the amount of relief that is being received to these small businesses, which I've encouraged people, to please contact your senator and et cetera, to try to encourage that to move along faster. But there's a question in here somewhere. But I just kind of wanted to know with these business owners that are getting more and more desperate, is there, and I know it's all up in the air, but is there some kind of time frame that we could look forward to of knowing when we could get to a level orange again or something like that?
Yeah, no, that's a great question. So, let's start with the relief. We've all following the national news on this, and we've heard that there is a package being floated around Washington, D.C. With some numbers attached that would increase or extend the programs that came out last spring, and hopefully that will help our businesses. But, you're absolutely right. People are desperate. This has been a tough year, right? So what, San Juan Basin Public Health has a self-certification program for businesses in place right now. We started this, we put it up in April. It was ready to go the first week in May. And, the state has released guidance for every business sector about how to operate safely. And we've asked our businesses to self-certify. Have you read your guidance? Do you understand it? Do you have the resources if it's going to take some resources? How can we help you get funding for the resources if you have to buy more supplies or put up plexiglass? That was part of it. And then it was, have you trained your staff? Does your staff understand it? Like, this was the self-certification program that we did in the spring because there wasn't funding for kind of a more robust across all types of industries. Because we're, like we've talked about, we're all in this together. We never thought about infection control in retail before. And so it was like, yep, every business is going to need to learn together how we do this. So the five-star program is really, it's an extension of, safeguarding all industries, all consumer protection, helping businesses be able to operate safely. At the same time, there's questions about when is the right time to have more mixing of households and more mixing of people while we're still in high rates of disease. So we don't have, that conversation is not through yet. We're expecting information next week from the governor's office about what this will look like. Our program that we do for self-certification is part of the mix of things the governor's office is reviewing, and we'll take some information from that, look at what other communities have done, and then make recommendations about how we can really provide good information so businesses can operate safely.
Absolutely. And I definitely want to encourage people, takeout, delivery, this kind of thing, and go and support these businesses as much as you can. Buy gift cards. Gift cards is an easy way to help in the future. I did have one kind of just crazy idea. I don't know if this would be highly discouraged, but I just kind of want to ask, and it's kind of a weird time being winter and everything, but what about like a car hop situation? Like, what if they brought back the old time car hop dining? Is that something that might be something that could be thought about?
It's funny because I love it. We have seen lots of mountain towns in Colorado and in the Denver area create winterized outdoor dining where they've put up little tents. You can do one large heated tent if it meets some criteria about ventilation, or you can do individual tents. And we've seen pictures, all over the state of interesting things people are doing. I have not seen anyone do that. And I think it's really awesome. I think in this day and age, we would have a hard time having our engines running, because I think we have a different lens on, air pollution. But I do like the idea. I love it, and I haven't seen anyone do it.
Well, thanks. Yeah, it just came to me, and I was thinking, well, if you can't eat, but you can still come to the restaurant, just stay away from the other people, and that's a way to do it. Stay in your car and just eat from there. And, why not? They did it in the 50s.
Right. Well, I think in the 50s it was a little bit easier to keep your car idling, right?
True.
So I think there would be some adjustments. But I think we've done car parades, and we've done car parade high school graduation. So sure, why not a car hop? I love it. I totally love it. Yep.
All right, well, let's get the word out.
All right.
Well, thanks so much for joining us again. Is there anything else you'd like to get out there today?
No, just remember, everyone, please wear your mask. Be as safe as we can, maintain your 6-foot distance. But really, more important than either of those things is just let's not mix our households unnecessarily. Let's not go out and do things indoors together until we get through this tough winter. I know we've talked here about there's some good news coming, but there can be a ton of bad news before we get there if we let our guard down now.
Absolutely. Well, as always, thank you so much for joining us today, and I guess we'll catch you in a week.
Okay, thank you.
Thank you. All right.
Bye.